Those two projects at the Glendale mega site took a lot of work to get here. A lot of work on the state level, but I got to tell you, a lot of critical work in relationship building on the local level. This is the Commonwealth's largest ever investment, and it's not even close. $5.8 billion. It's going to create 5,000 jobs, but it is so big it's hard to process. I call it planetary in that it has a gravitational pull. I can tell you we got new calls from potential suppliers to this facility as early as this morning, or as recent as this morning. And these 5,000 jobs and $5.8 billion are just the start. And that's a heck of a statement when you're making a comment about something that large. It is transformational for the whole state. And I'll tell you what, I'm proud of our state and our people, because no matter where I am in Kentucky, people are excited about it. At SOAR, they were excited about it. Southern Kentucky, excited about it. Everybody sees the possibilities of how big this is and how it can lift us all up, and how it has everybody looking at us in a whole new way. The batteries that Kentucky employees, the battery that Kentucky employees are going to make at these two plants will power Ford and Lincoln vehicles for decades to come. They're going to help usher in a cleaner, greener, more sustainable future for our nation, and boy, are they going to power the economy of not just Kentucky, but the entire country. So here to talk about this project, we got Hardin County Judge Executive Harry Berry, Elizabethtown Mayor Jeff Gregory, Elizabethtown City Administrator Ed Poppy, and Rick Games, President of the E-Town Hardin County Industrial Foundation team. These gentlemen are all-stars. In fact, this week we're naming them Team Kentucky All-Stars. We'd love to hear from them about how excited they are, and I just want to, as they come on up, thank them for incredible work, working together, landing something that probably no one ever thought was possible. Gentlemen.
Well, thank you, Governor, for inviting us here today, and more importantly, thank you for your leadership, your vision, and your tenacity in being able to bring this project not only to Kentucky, but to our home in Hardin County. I'm pleased to be a part of this and for our entire region and our area. I have with us today, as you mentioned, the Mayor of Elizabethtown, Jeff Gregory, the City Administrator for Elizabethtown, Ed Pope, and the person that does all the work for us, Rick Games, the President of the Elizabethtown Hardin County Industrial Foundation. Over the last 20 years, we have worked diligently to make the Glendale site attractive to a project like this. We've done all the work to bring water and sewer, the utilities to that site, all of the environmental studies that needed to be done, just preparing the site and planning road networks and stuff that's going to be needed for something like this. And that's all been under the supervision of Rick Games in getting that done. So we're very excited in Hardin County about this project. I think our entire region is excited. As the governor mentioned, it's the biggest economic project that this state has ever had. It's the biggest investment that Ford Motor has ever made. So we are very excited to be able to have it come into Hardin County. And with that, I'll turn it over to the mayor. Jeff?
Thank you, Judge. Thank you, Governor. He pretty much summed it up. We're excited as can be in Elizabethtown, and we appreciate the leadership from the governor's office. We appreciate Secretary Larry Hayes and his leadership from his staff. It's been a really wonderful thing to be a part of, bipartisan effort with the legislator, and from the top to the bottom, everybody's worked well together and really appreciated the opportunity that we have in Elizabethtown, Hardin County, to have this Ford SK Innovation plant come down there. And like I said, nothing but excitement down there. The governor spoke with us earlier today, and he made a good point. Ford and SK Innovations, they have bet on the people of Kentucky and the people of Hardin County and the people of Elizabethtown, and we're going to do everything we can not to let them down. So thank you to everybody that was involved, and we appreciate the opportunity to work with these different companies. Thank you all.
Thank you, sir.
Thank you, Governor. Well, and Ed, my apologies. For a $5.8 billion project, I should have been able to get your last name right. So we'll say it again. Ed Pope, the Elizabethtown City Administrator. With a project this size, everybody's going to be able to pronounce it. I went through a little bit of that with my dad in this job not too long ago. these are great public servants. They worked really hard on this. Whole Commonwealth's going to remember for decades to come your work, and they're absolutely right. Ford is betting the future of one of America's greatest companies, and who they choose to bet it with? The people of the Commonwealth of Kentucky. That says something pretty special about us. So thank you to those Team Kentucky All-Stars. Today, we have another special guest. Joel Streeter is another of this week's Team Kentucky All-Stars, representing one of Kentucky's fastest growing manufacturers. Joel is president of KCC Companies, a Louisville-based manufacturer of roof systems, including curbing that surrounds and isolates rooftop HVAC systems, as well as skylights, hatches, gutters, flashing, and more. KCC designs and manufactures products for a range of industries, including agritech, something we're committed to being a leader on here in Kentucky, and healthcare-related facilities, schools, retail, hotels, and restaurants. KCC has operated in the Commonwealth since 1977, and I can tell you that's 43 going on 44 years, and already employs more than 550 people in Kentucky. Last week, KCC broke ground on a pretty special project when you think about its current size and where it's going, a $60 million facility in Simpsonville. The project is going to take the company's business to the next level. KCC will construct a 380,000 square foot manufacturing facility, as well as a 40,000 square foot R&D operation on 80 acres in Shelby County. And the best part, 700 well-paying jobs for the people of the region. Think about that. Going from 550 and adding 700, that's another bet on the people of Kentucky by a great Kentucky company. These positions pay an average hourly wage of $29, including benefits, and will create hundreds of new opportunities for residents in Shelby County and the surrounding region. So here to tell us more, Joel Streeter, also this week's Team Kentucky All-Star. Thank you.
Thank you, Governor Beshear. I appreciate the opportunity to come and speak today. For those of you that aren't familiar with KCC, as the governor mentioned, we have been Kentucky proud since 1977. Just a guy with a truck and some equipment and a dream of making people's lives better, Al Fiorini moved from Charlotte, North Carolina, and founded KCC. As we prepared our long-range forecasts recently, late last year, after growing 30% a year since 2012, it became obvious we would soon outgrow our current facilities. We reached out to our local community developers, Hollenbach Oakley, and identified several potential sites. As part of the process, we also contacted Team Kentucky to determine how we could partner with the state to move our project forward. That was 10 months ago. And last week, we broke ground for our new campus in Simpsonville. Our products improve the indoor air quality of commercial buildings, which, given the events of the COVID pandemic, are crucial to people's well-being. We have supplied HVAC equipment to restaurants, office buildings, testing laboratories, indoor grow facilities, and schools, among many other applications. While improving health and welfare, our design also reduces energy consumption. That's good for our community, for our Commonwealth, and our nation. And we change the world in a small way from right here in Kentucky. Our company employs engineers, salespeople, HR professionals, assemblers, welders, electricians, HVAC technicians, plumbers, maintenance specialists. The list goes on and on. But it's more than just a place to work. We create opportunities for people to make a career. Our rate of growth means that new positions are opening nearly every day, and we make it our policy to promote from within whenever possible. Pages stick together. But wait, there's more. It's more than a career. We are employee-owned, which means that our team has a retirement plan with great value. We change people's lives for the better. All this from an all-American beginning. Along the way, we partnered with others, and I stand here today in a spirit of gratitude. Our company is thankful to the governor for the administration of a great public-private initiative. Your team is truly top-notch, Governor. Thank you to the legislature for funding the program that allows business to flourish here in Kentucky. Thank you to our employee owners who make it happen every day. And thank you to the great people of the Commonwealth of Kentucky, our home. No one person wins a championship. It takes a team. The team that came together for this project will be celebrating championships for years to come. Thank you. Briefing notes out of the way.
And thank you, Joel. That gave me chills. From now on, you can do the Team Kentucky update for all of us. Now, what a great company. What great energy, right? This is why we love where we live and who we are. And in many ways, I think it's some of that spirit and feel that Ford could see and SK Innovation could see in us. We look forward to continuing to work with a great Kentucky company. Started by a guy in his truck. That's where it should all start. So thank you so much. All right, but it doesn't stop there. We talked a little bit about some announcements we made earlier this week. How about Horse Soldier Bourbon? Horse Soldier Bourbon is a company with an incredible story. The company was founded by retired members of the U.S. Special Forces who entered Afghanistan on horseback following the terrorist attacks on 9/11. These Green Berets, who were training on the Cumberland River at the time of those 9/11 attacks, became known as horse soldiers. 20 years later, they're back in Kentucky and building on our thriving bourbon and spirits industry, which employs over 5,000 Kentucky residents. In addition to the distillery, this campus will include a visitor center, activity center, amphitheater, outdoor event space, adventure center, wedding chapel, lodging, and a retail village. I got to tell you, it is a huge, exciting concept, and these guys have proven time and time again that they deliver. The project represents economic growth, tourism growth, and the continued success of the bourbon industry in the Commonwealth. I want to once again thank the leaders of Horse Soldier Bourbon. Incredible folks. And I got to tell you, a lot of them are originally from Kentucky. And talking to some of the members of this group, one from Paducah originally, one from Northern Kentucky, all who served our country so admirably. And they and their families being such a special part of this company and now a special part of Kentucky. And you could tell during the ceremony their very deep commitment to this state, to the Somerset region. We're going to be hearing a lot about this for years to come. Also on Tuesday, I joined the leaders in the Corbin-Williamsburg community to celebrate the official groundbreaking of Cumberland Mint, a new horse racing facility that's expected to create 213 jobs, full-time jobs, in the area. So Cumberland Mint is run by ECL Corbin LLC, a joint venture between Keeneland and Kentucky Downs. The new project represents a $90 million investment into the Commonwealth's booming tourism and horse racing industry. It'll bring horse racing, historic horse racing, and an entertainment venue to the area of the Commonwealth that hadn't seen one of these facilities or this type of opportunity. It's going to boost tourism, revenue, and economic vitality in Whitley County, Williamsburg, and Corbin, and the entire southern Kentucky region. The new Cumberland Mint Racing facility will feature 2 locations, one in Williamsburg, which is 13 miles from the Tennessee border. And we're looking forward to many Tennesseans visiting it and leaving their dollars right here in the Commonwealth. The second location will be in Corbin, and ground's expected to be broken on that site later this year. The project will strengthen some of Kentucky's strongest industries. And you think about it, between this $90 million facility, $200 million in Horse Soldier Bourbon, $10 million that we were able to put in the Community Technical School in Barberville, the new App Harvest facility going in outside of Somerset, and Firestone adding 250 jobs in Whitley County, over $400 million of new investment in that region in just the last about 4.5 to 5 months. We've never seen this before. It's exciting. We're up to the challenge, but again, this is showing how in every region we have new opportunities and potential, the likes of which we have only dreamed of. It's our job, this generation, us right here, this administration, to make sure we make it happen. That'll be, it's our obligation to my kids, to your kids and your grandkids. But next up, we have Summit Packaging Solutions, which is creating more than 250 new jobs with a new facility in Boone County. The manufacturing packaging company is creating 69 direct full-time jobs, as well as 185 contracted production positions with more than an $18.3 million investment. The operation will allow Summit to increase its production of a variety of packaging products for customers in Kentucky and elsewhere in the United States. And they're not wasting any time with the facility expected to be open in a few weeks. And I just want to go back to a little bit of what Joel said about KCC. And we tell companies we can help them be first to market. They went from first conversation with economic development to groundbreaking in 10 months. That's something that's hard for other states to compete with, and I'm proud how we all can work together to make that happen. Summit leadership recognizes the many advantages of locating in the Commonwealth, from Northern Kentucky's extensive transportation network to our state's available skilled workforce. And I tell you what, Northern Kentucky has seen announcement after announcement after announcement. Again, a great group of local officials help work to make it happen, an exciting area of major growth, whether that's the 600 new professional jobs at Fidelity, the 300 plus new jobs at Dollar General, or these jobs we're talking about here today, an exciting role that Northern Kentucky and all of Kentucky is in on. So again, I want to thank all of this week's economic leaders, especially at Summit, Horse Soldier, and Cumberland Mint. They are our Team Kentucky All-Stars. More good news, because we deserve more good news. Last week, the Consensus Forecasting Group issued its preliminary revenue forecast for the current year and the next biennium yesterday. This is the group that, under statute, is an independent group of economists. And what they do is they come together to give periodic forecasts, educated predictions, if you will, modeling that they do, on what our economy will look like and what our state revenues will be. These are the estimates that, under state law, have to be used in creating a budget. And until the last two budgets were always used as virtually the exact numbers. Last two budgets, the legislature departed from them, but our revenues ended up in excess of the forecast. So the final official forecast will be issued in December, but we have a really good initial report which helps us plan as we move. So this is not the official forecast that's to be used under statute for the budget. This is a preliminary one leading up to that, but it gives us a good concept and idea of what's to come. The current year, fiscal year 2022 general fund revenue estimate is $13.56 billion, $1.7 billion higher than the budgeted estimate. In other words, our revenues are projected to significantly exceed by $1.7 billion what was originally estimated. That is a good sign. It assumes a growth rate of 5.7%, excluding the $225 million PokerStars settlement. The growth rate is 3.9%. Business taxes currently growing at 10.6%, sales at 7.1%, income at 2.5%. General fund estimates for fiscal year 23 and 24 also look pretty good. $13.722 billion and $14.19 billion, growth rates of 1.2% and 3.4% respectively. Current year road estimate is also $80.5 million higher than what was budgeted, and that assumes a growth rate of 2.9%. Just about every area are growing: motor fuels taxes and vehicle usages. This is on top of our announcement in July, when the State Budget Office reported that the Commonwealth ended 2021, the fiscal year, with a general fund surplus of $1.1 billion, the highest ever in the Commonwealth, and a 10.9% increase in the general fund receipts to $12.8 billion. Folks, our house is not only in financial order. We not only have the largest rainy day fund in our history, but our general funds are everything. Corporate income tax and the rest are higher than we've just about ever seen. It means not only are we bouncing back, we have bounced back, and we are seeing really significant returns. Now, that doesn't mean that there's not more opportunity out there, but it does mean that we have a healthy, robust economy that actually has an appetite to grow and to grow significantly. Now, with all this opportunity, and there is a huge amount, I'm telling you, it's so much opportunity that in many ways we need more than one governor. Thankfully, we have a governor and a lieutenant governor. So today, via video, our lieutenant governor has an announcement of a change that we're making so that she can help in this day-to-day process of making sure that every one of these economic development opportunities, every one of these potentially Commonwealth changing opportunities we're seeing, that we grasp.
It has been the honor of a lifetime to be the first lieutenant governor in Kentucky's history to simultaneously serve as the Secretary of
they have
Education
the
and
audio
Workforce
on?
Development. As someone who has dedicated my life to the kids in our classrooms, I'm accustomed to wearing multiple hats, and I am grateful to Governor Beshear for the opportunity to serve. Through some of the darkest days of the pandemic, the Education and Workforce Development Cabinet was able to move forward with our mission to build a cradle-to-career education and job training system in Kentucky. Improving the lives of every Kentuckian, no matter their zip code, is a charge that EWDC has answered. Here are just a few of the ways EWDC has delivered on that promise. Our very first initiative was the free GED program. By waiving the $125 testing fee, we were able to remove the greatest barrier for the 300,000 Kentuckians who do not have their high school diploma or GED. We prioritize broadband as a critical component of our infrastructure. As COVID-19 closed physical buildings, learning and working from home became necessary to keep Kentuckians safe. Through a collaborative effort, EWDC was able to lead the way in helping our administration close the digital divide from 15% of households with school-aged children to below 2%. That work continues for the remaining unserved and underserved communities across Kentucky. We established the Commonwealth Education Continuum to close the gaps along the cradle-to-career pipeline where we lose our most vulnerable students. I was honored to chair the committee responsible for diversifying the teacher workforce. It was through this work that I learned funding for the Kentucky Academy for Equity in Teaching had been cut, stifling the state's ability to recruit more teachers of color. So we were able to invest $1 million from EWDC's workforce funds to relaunch this initiative. Often, teachers are the first leaders a child experiences outside of their home, and every Kentucky child deserves to see themselves in those leaders. We address the pressing issue of student mental health. Over the last 2 years, we have all become more cognizant of our mental health, and it calls for immediate action. So I enlisted the help of the Kentucky Department of Education's Student Advisory Committee, and together we have traveled all across Kentucky, hosting a series of 10 regional student mental health action summits. During the next legislative session, these students and I will make policy recommendations to lawmakers. There is so much work to be done in the education and workforce development arena to support an economy that is on fire. While I am grateful for the opportunity to serve in a dual role in the administration, I know that seeing these commitments through requires a laser-like focus. So today, I am saying farewell to my position as Cabinet Secretary because I know it is in good hands. Deputy Secretary Mary Pat Regan will assume the role of Acting Secretary of EWDC. Governor Beshear and I have the utmost confidence in her leadership, and we know that she will make Team Kentucky proud. My focus as Lieutenant Governor and my commitment to the Beshear-Coleman administration remains the same. It'll just look a little different as we respond to the demands of a booming economy. As the governor likes to say, our time is here and our future is now. Seizing this moment is critical to building a better Kentucky for all of our families. Thank you.
All right. Thank you to Lieutenant Governor Coleman for all of her incredible service. That service is just continuing in a different way. Again, so much opportunity out there right now. We need more than one of me to make sure that we realize every future game changer. Again, so many out there right now, certainly Ford being one. We're excited about everything the Lieutenant Governor brings to the table. You're going to be seeing much, much more of Lieutenant Governor Coleman. Now, moving over to COVID. All the trends continue to be, again, pretty positive. But remember that deaths trail those trends. We don't have today's report, but we think today's report will include two pretty young folks, I think one in their late teens or early 20s, and a baby. Now, that infant, we believe, had multiple issues, that complications that the child was facing, but that will be on today's report because one of those major challenges was COVID-19, something we never want to see. And again, a reminder that it can impact anyone, and whether or not it is the only cause of us losing someone, if it's what puts it over the edge or even just contributes to that loss, there's something that we can do about that. And that's everybody getting vaccinated, doing what it takes, masking when it's appropriate to protect one another. On the good news side, hospitalizations have now decreased 19% over the last 7 days in our rolling data and averages. We're down to 57 hospitals that are reporting critical staffing shortages, though we do not believe that those staffing shortages are as bad as they have been. We're actually looking at plans and future plans on the National Guard. What's expected is that we'll begin as hospitals get in a better place to draw down some, but not all, of our deployed guardsmen and women to ensure that those hospitals, when there are flares or they're still hit particularly hard, have the support they need, while also allowing our guardsmen, our individuals serving, to get back to their families and their communities and their other jobs, their day jobs, their regular jobs, when the situation allows. 182 adult ICU beds available in the state right now. 12 pediatric patients hospitalized for COVID-19, 4 confirmed in the ICU, 2 on ventilators. We'll show the updated charts. First, hospitalization. Again, a good continued downward trend. This is what we want to see. While the slope of the decline is not as severe, it's not a straight up and down, if you will, vertical, as the incline, it is still moving down fairly quickly. It is a good sign, and we see that also on the ICU chart, as well as the ventilator census. These are all good things. You know, a graph only tells you so much, but it does help show the speed that things are getting better. At the same time, it gives us comparisons on where we were. We should be grateful that we now have fewer people on a ventilator than at the height of our winter surge, but not by a whole lot, right? We hope it continues to go down, but let's not punt on third down, right? Let's make sure we continue to do what it takes to get this down to those levels where we were all feeling great. Remember coming out of that winter surge and where we were for a period of time, we want to be again. Because not only was it a good place to be, it was also a safe place to be. So let's not cheer and celebrate while we're still at where we are. Let's do what it takes to continue to push this decline. Let's move over to vaccination status, cases, hospitalizations, and deaths. Haven't shown this slide in a little while, only a little bit changed. 84.5% of every case that's reported is an unvaccinated Kentuckian. But then you look at hospitalizations, 92% of everybody hospitalized unvaccinated. And then you look at our deaths. You know, this is one of those reasons why we got to make sure we continue to do the right thing, even around vaccinated individuals. Because when we expose those that have major pre-existing conditions over and over and over, if they have a breakthrough case, unfortunately, it can still have very negative outcomes. Let's look at the rate of COVID-19 cases and vaccinations. Even where we are right now, vaccines still holding pretty effective, more than 4 times more protective. It's 4 times higher if you're unvaccinated than if you're vaccinated. So they are providing that type of protection, which is very similar to when the initial vaccine was out fighting what was then the Alpha variant. Other good thing to see on this chart is how much lower the different bar graphs are. That again shows that the level of disease is declining. Now, I know I've at least heard some news that some school systems are already looking at going to masking optional. We know and we have seen that will increase COVID in your area. I do believe there's going to be a time during the course of this entire school year where that is likely possible and safe. But with vaccines on the horizon for 5 to 11-year-olds coming what we think is really fast, hold on. Again, don't punt on third down. Make sure we continue to push this through. And there's no question that there is still, if we went back to those line graphs, which we don't need to, there is still almost as much virus out there right now as there was during some of the difficult parts of our previous surges. And that was a time that we were certainly wearing masks, and none of us at that time in schools were even objecting to it. Let's put up age and vaccination status of COVID-19 deaths. Again, if this shows that, I mean, with a few exceptions, if you are under 50 years old, this thing is only killing unvaccinated Kentuckians. I mean, if you added it up, it's 8 compared to, what, about 230 or 40 vaccinated versus unvaccinated. And I will tell you that this Delta variant, which continues to be out there, continues to be the main strain that we're seeing, is killing more people in their 40s and in their 30s than we ever thought was possible. But for the most part, it's not getting vaccinated individuals of that age group. When you look at the 70 plus and the 60 to 69, this is the importance of boosters. More people in this age group suffer from the types of conditions that COVID comes for. So if you are already eligible, and we're going to be talking about some of the others for a booster, go get it. Don't wait. If you're over 65 and you have Pfizer, you need it now. If you have a condition that makes you more susceptible and you got Pfizer, you need it now. If you got a job that is forward-facing where you see a lot of public and you had Pfizer, you need it now. So make sure you get it. You've already taken so many steps to protect yourself, and at least early indications are that if you go get that third shot, you are back up maybe even to that 90+% protected. And we know that we got a lot more breakthroughs with J&J and with Pfizer, so go ahead and get that done. Let's show the pie chart finally. I won't have a lot of comments on this, but again, this shows in many ways how well vaccines work. Remember, 70 plus is the most vaccinated group. Look at how much, by more than a quarter, that deaths to that age range have shrunk. But now it also says 50 to 69, you need to get those vaccines. You need to get your booster. This is in part how deadly the Delta variant is. All right, so moving into boosters. Today, advisors to the CDC are meeting to vote on recommendations about mixing and matching booster doses. All 3 approved vaccines, Pfizer, Moderna, and Johnson & Johnson, are going to be included in this discussion. What that means is eligible individuals who've received their first 2 doses of Moderna or Pfizer or 1 dose of J&J can receive an extra shot of any COVID vaccine if they approve it. After the meeting between advisors, CDC Director Rochelle Walensky is expected to make the final decision. She could sign off as early as today. We will bring you the final recommendation. This is going to be announced along with the FDA's authorization of Moderna and J&J boosters for those that are eligible. We expect to get some final word on those soon as well. It's our expectation, though it could come out a different way, that there may especially be a recommendation for those who got the J&J vaccine to potentially get a booster of either Pfizer or Moderna. The Moderna vaccine is still holding up really well, especially comparatively. We think the booster's going to be out there for a third dose. It'll be interesting to see what's recommended as far as that vaccine in mixing and matching any other vaccine. So more to come on that when we learn of it. Vaccines for youth, 5 to 11. We expect the FDA and the CDC's decision on Pfizer's COVID-19 vaccine for that age group in the next couple weeks. Yesterday, the federal government released its operational plan to ensure that we can vaccinate our kids when the time comes. That plan will ensure that we have the supply, the sites, and the support needed to get Kentucky's children vaccinated. My daughter falls in this age group. We will have these vaccines out there so that you can get your kids vaccinated as soon as it is approved. The plan says the federal government will have ample vaccine supply for our nation's children. It won't have supply for 100% of them on the day after it's approved. Remember, Dr. Stack walked us through, it is a different packaged vaccine. It needs to be. They can't simply do less of an amount of the adult version. It's packaged even in a different color. So it's very important that that product get out to all around Kentucky, which is what we're working on right now. Over the past month, we've been planning with the federal government, pediatricians, pharmacies, community health centers, and other vaccine providers. DPH has been planning directly with these providers. Now, I will tell you that many folks might think that most of these will be at pediatricians' offices, and we have had some sign up. But it takes a lot to sign up for a vaccine, and we haven't seen as many pediatricians around the country sign up as some might expect. But we believe that's in large part due to the fact that there is already an existing supply chain that the current vaccines are going to. In other words, some of the pediatricians are saying, I can just tell them to go to Walmart or Walgreens or Kroger or anywhere else to be able to get it. And we'll also be working with our schools to try to have it there. So I'd just say don't be surprised or alarmed if your pediatrician might not be signed up to give it, and that would require getting it and storing it and providing it. It's going to be everywhere across Kentucky in all of your communities. But make sure you have that discussion with your pediatrician about it if you have any doubts or any concerns. All right, finally today, you may notice, and then we'll have two final updates, that we're not doing the demographics on vaccine data. We are in direct conversations with the federal government over some concerns on some of the numbers that we are seeing in their system that lead to things like 105% of a certain age demographic in a certain county being vaccinated. We thought that part of that would fix itself when we use the new numbers coming out from the census, and it hasn't. So we're going through different data, having conversations with them. Next week, we hope to have some final answers that we can talk about with the federal government, making sure that the numbers that we get from them and that providers report to them are correct. We have at least some concern that at least in one program there may have been some double counting. We want to make sure that we get it fully accurate so we know where we are. I don't think in the long run it'll change where we are as compared to other states, but if there was some double counting, it will mean that we have fewer Kentuckians vaccinated than we previously thought. We'll be transparent with it. We'll answer every question we can, but like every other time when there's been a system issue or others, we've wanted to make sure that we both preview it with you, knowing it's coming, even though we don't have all the answers, and then provide those answers as we get them. All right, two final pieces that are related to healthcare. Number one, Connect. Health coverage enrollment in a commercial insurance plan for 2022 opens November 1st and stays open through January 15th. As a reminder, you can get a head start right now on connect.ky.gov. Since last Friday, when Connect opened for previewing plans, over 3,500 different Kentuckians have paid Connect visit the Connect website a visit to shop for plans. Over 350 Medicaid members have already conveniently made their plan changes. If you are receiving Medicaid benefits and you want to switch your plan provider, you can do it right now on Connect. through December 1 on the portal. Medicare open enrollment for a health plan or drug plan also started October 15th and continues through December 7th. So the private insurance plan, that's one area. Starts November 1st, goes through January the 15th. Medicaid, you can get on right now to change plans and benefits. That goes through December 1. Medicare open enrollment, open now, goes through December 7th. Plan comparisons and enrollment for Medicare are on medicare.gov. We are excited that Connect is back. It's going to help us to tailor our plans for you, Kentuckians, to make sure you are getting the very best. And also Connect has a lot of other help, especially if you're struggling just a little bit. You need a little bit of help to make sure you are on your feet providing the very best for your kids. Remember, there's so much help, especially for our kids, whether those are SNAP benefits or whether that's the K-CHIP program. Make sure your kid has health care coverage. Make sure that you have health care coverage. Help is out there. Go to Connect. And finally, our Kentucky Rural Hospital Loan Program. I want to highlight this because, oh my goodness, how incredible, but also how important are our rural hospitals. The Kentucky Rural Hospital Loan Program is making $20 million in low-interest loans available to hospitals throughout Kentucky. The funds will directly impact 1.8 million Kentuckians in rural areas and make sure they have access to high-quality health care, which we now know is the difference between life and death. Eligible hospitals can receive $25,000 and up to $1 million per facility with a 1% fixed interest rate. Most of us would like that rate. Hospitals located in Kentucky County with a population of less than 50,000 are eligible to apply. You can use it to upgrade existing facilities, retain and increase staff, and provide healthcare services not currently available in every community. So one question about what's available now to help retain staff for these hospitals is this program with up to $20 million in it right now, with up to $1 million per facility at a rate you could never find with a commercial lender. Loan requirements are up on our website. I appreciate the state legislature for help making this a reality. It is a great step forward. All right, with that, we will open it up to questions because of the audio. We've got two live journalists, and we've got others that I will have to read the questions from. So let's start with Carolina.
So, Governor, just clarifying, once Pfizer's vaccine is available for kids 5 through 12, will Kentucky be ready? And then also, once those kids are vaccinated, does that vaccination status play a role in schools' decisions on masking?
So we will be ready to vaccinate our children the day after. It typically takes a day that the final approval comes from the CDC. People ought to be ready to go primarily to the types of places that are providing the adult vaccine. Think about all those different groups that are out there. I'm likely to sign my daughter up for one of the pharmacies here in Frankfort. If we can get enough 5 through 11-year-olds, but remember, we haven't been able to get enough 12 to 17-year-olds vaccinated, then absolutely it can play a role in masking. But we'd have to reach that threshold of how many kids we got vaccinated, and then look at the incident level, how much disease there is in a region. But it's something that I hope will be analyzed by any school board that's sitting down and looking at all of it. In other words, they say, well, our cases are coming down, that's a good thing, but our vaccination rate isn't where we want it to, and that's a bad thing, right? And so being able to look at all of those different factors and then consult with the local health department, I think gives us a lot more information about not only how much disease there is, which we can find, but how protected those kids are and how likely they are to spread it to each other or their teacher. Tom.
Thank you, Governor. Good afternoon. Once the boosters are okayed and the ones for the kids are okayed, will the state be reopening some of those regional centers like they did when the vaccines were first made available? And you had a
Right.
big rush. You had one here on the west side of Frankfurt, for example. Will that be going in, something similar to that? And secondly, if I may impose, economic development. We're hearing that Kentucky is in the running for a Toyota battery plant similar to the Ford plant that you announced a few weeks ago. What can you tell me about that?
Well, I can't speak to any potential target and or opportunity in economic development right now. Any talks, if there are any, are confidential. And as you know, that Ford announcement, we were joking around telling you it was Willie Nelson who was going to come and play. It's just that confidentiality is so important to companies as they make their plans, whether it's for their competitors or shareholders or the rest. We do not expect to have large and will not have large vaccine regional clinics because we don't have to. There is already so much capacity over so many different places across Kentucky that we're going to be able to sign people up. The boosters show that. You know, a lot of people right now are getting their boosters and are able to get it pretty quickly. But we do need to think and talk to schools about what they can do, and then harder to reach communities. We may need to be able to do more of the pop-up clinics like we did early on. Karen Czar says, what do you think has been the key to bringing these new economic projects to the state, and what will our administration be doing to draw more companies? Let me start with the second piece. We need to keep investing, and especially the potential sites for these major investments. You look at Ford, and we had an incredible mega site that had already had most of its utilities brought to it, that was in the road plan for a new exit. It had millions of dollars rightfully spent on it over the years with a lot of foresight. We need more investment like that. Now, we make it over time, so it doesn't hit us too hard at any one time in the budget, but we need to make sure that other communities out there that have good sites, that we are partnering with them to make sure that they have the investment, the utilities, that we can make things as build ready as possible, because we believe that one of our best selling points is being first to market, meaning we can get them up and running faster than just about any other state. And that's because of really good coordination. Number one, between cabinets, and number two, between local and state government. We haven't seen any issues there. And looking back in the past, not during this administration, sometimes you'd see those. They're just not there. Everybody wants to work together. Everybody is excited, and we want to make sure that we are investing with our local communities on their local sites. Why do I think that we're seeing what we're seeing now? First, I think we are a state filled with amazing people. Maybe just people needed to see us a little bit more and know who we are. We've heard a number of different things from those that have looked at us. One, that we're aggressive in marketing ourselves. Two, that we are easy to work with and talk to. Three, that we create confidence. But I also think in a world right now that seems to be overcome by division, of sometimes silliness, of everything being red or blue, and sometimes even economic development being that way, we're not going there. You know, during this pandemic, I think we showed we can rise above the noise and do the right things, and people notice that. They talk about it to us when they're here. You look at Ford and being able to work directly with the legislature dominated by a different political party than I am. But you know what? Everybody was on board. Everybody worked on it, and we made it happen together. People are seeing that we can get things done, in part because we push all that silliness aside. See, the secret to our future isn't red or blue. It's rising above all that. It's just doing the right thing for our families. Everything that a person worries about at the end of the day after they put their kids to bed, none of that falls into Democrat or Republican, red or blue. It's your job, it's your health care, it's the education of your kids. It's hoping that they have a brighter future. I mean, that's what we ought to be doing every day in government. And the more we focus on that, the more people notice, and the more people want to come and be a part of that, especially in the world as wild as it is right now. Sarah Ladd, could we get an update on what y'all are expecting or thinking with regards to the possibility of another big wave this winter as people gather indoors for holidays and just in general? I think it's complicated. I think when we look at all the different factors, and first let's be humble. This virus has acted in different ways than we might have thought or predicted so many different times. What it's taken to get to herd immunity is more than we initially thought. And as the virus mutates, again, we've got to be humble in what we know and what we don't know. I think it'll really come down to how many people we can get vaccinated. Sadly, how many people have had the virus and what level of immunity that creates for how long and how many of them we can get vaccinated, and how dangerous, how aggressively whatever strain we're dealing with at that time spreads. And so while some are predicting this or that, those predictions have rarely been right. What is within our control? Again, vaccines, wearing a mask when it's the right thing, getting the boosters. Let me add, I think people getting boosters is going to be a big difference as well, because when we saw, once we had the vaccines, the virus drop off a cliff. When it was spreading at that time aggressively with the Alpha variant, boosters can help us do the same thing. Think about it. If we could get closer to no breakthrough cases, that'd be pretty exciting, and it certainly narrows the number of folks that this thing can spread through. Melissa Patrick, dropping out of the red zone may trigger a number of Kentucky schools to drop their universal mask requirements. Is that a bad idea? Yes. Yes, there's still too much virus out there right now. We know it spreads in schools. It's the most unvaccinated people in the most poorly ventilated areas, closer together than anywhere else. That's exactly what the virus wants. On top of that, it's folks that might not even show a single symptom, meaning they can go out in their community and continue to spread it. I'm a parent who wants my kids to stay in school. Their best chance of having the most days in school is universal masking. Their school's been doing it since the very beginning. They went back at the 1st of August. My daughter has missed one day due to COVID. And now, didn't have COVID, but due to COVID, one. My son has missed 0. This is something that works. When we get to a safer place, we may be able to drop this protection. But if our goal is not to appease some angry parents, but to keep our kids in school, then yes, please keep that universal masking up and going. Have I had any interaction with Republicans on the $400 million essential worker incentive? I haven't seen a communication back yet, but we haven't pushed it or asked for a deadline, knowing when the legislation would come through. My hope is that regardless of how they feel about it, I hope they feel good about it, that they will at least name some folks and we can sit down and start talking about it and see what the possibilities are. Remember, we left a lot of the decisions to be made by the group. The legislature has told journalists that they wish there'd been more consultation at different times. I'm asking for it. Let's sit down and let's consult. Lawrence Smith, will the Department of Education recommend that school districts require kids 5 through 11 to be vaccinated? I'll see it as there hadn't been a requirement for 12 to 17-year-olds. I don't necessarily anticipate that there will be a requirement at this point. However, I believe that we should push as hard as we can to provide accurate information to every parent out there so that they can see that I think the medically advised decision, the scientifically backed decision will be to get your kids vaccinated. I will get my daughter vaccinated. I got my son vaccinated. I love those 2 kids more than anything. I had an amazing time when I took a couple of days off with them. I love being their dad more than anything in the world, including this job, which I love, even in the tough times. I got one vaccinated. I will get the other vaccinated as soon as I can because I don't just believe, but I know these vaccines are safe and will protect them. Okay, a couple questions here about the new energy agenda that was released this week. The document talks about sustainability but doesn't mention climate change specifically or any goals to reduce carbon emissions. Well, first of all, climate change is real. I believe it. I think I'm the first governor to say that out loud, but it is simply true. And the private sector is now demanding more clean energy, but also reliability. That's why when you look at this plan, while it might not have a couple of magic words that people are looking at, it talks about a broader energy portfolio, investments in things like hydrogen, which will allow natural gas to burn more cleanly. We talk about our commitment to the environment, but how it can go hand in hand with our energy production as well as our economy. These aren't things that are in conflict any longer, and we keep trying to make them. So when we talk about sustainability and we talk about having a broader portfolio, sure, we recognize climate change, but we know that there are new forces that are pushing us in directions that ultimately everybody should be able to agree on, because whether it's you like the new jobs or you like the having more forms of cleaner energy, it's important. And with that said, there's always going to be a part of our energy portfolio, at least in the coming decades, that will be based in part on fossil fuels. We need to find ways that we can burn them more cleanly. That's one of the reasons that hydrogen can be so important, because without them we cannot have the reliability that we have right now on the fact that the lights are going to turn on the next day. So again, like everything else, it doesn't neatly fall into a bucket, but that's the world, right? That's what we're looking at. You know, our companies that are coming in say, you know, we want to get to net zero emissions, but we want to make sure that we always have the energy to power our plant. That's good, right? That's the real world, in that it's not just red or blue. It's a little more complicated. That's why our plan is a little more complicated and nuanced. But these things are not in conflict. And the more that we treat them like they are, the more political noise we create that keep us from getting to a place where the private sector, the public sector, and everybody else wants and needs to go. All right. Okay, I think we answered the rest of these questions. Again, I want to thank our Team Kentucky All-Stars. Grateful that our COVID numbers are declining still. Far too many deaths. Protect one another, because all the stuff we started with is so incredibly exciting. Your kids and grandkids are going to have more possibilities than we could have ever imagined. Make sure you take care of yourself and the people around you, so you're here to see it. Thank you all very much.